Welcome.
Mm,
Let's explore blood pressure beyond salt. When someone gets diagnosed with high blood pressure, the advice is almost automatic. First, a quick look at salt itself, and that sounds reasonable. It's simple, it feels actionable. But here's the problem. For many people, that advice is incomplete. Not because salt doesn't matter, it does, but because salt is only one small piece of a much larger puzzle. If you focus on sodium alone, you may miss the real reasons your blood pressure went up in the first place. So, in today's video, we're going to break down the often overlooked drivers of high blood pressure,
mm.
including nutrient deficiencies, metabolic issues, and hormonal factors, and what you can actually do about them. Section 1: How sodium truly works. Let's start with what we know. Sodium increases blood pressure by pulling water into the bloodstream. More fluid in your blood vessels increases volume, and that can raise pressure inside your arteries. That part is true. But here's what often gets left out. In a healthy body, your kidneys sense that increase in blood pressure quickly. They respond by excreting excess sodium and water through urine. As volume decreases, blood pressure comes back down. This system works remarkably well if your kidneys and metabolic health are functioning properly. That's why some people can eat salty foods and never develop hypertension. There's wide variability in salt sensitivity. So when blood pressure stays high even after reducing sodium, that tells us something important. The issue may not be the salt itself, but how your body is handling it. And that's where the deeper causes begin. One of the first things I look at is magnesium. Magnesium plays a critical role in blood vessel relaxation. It helps produce nitric oxide, a molecule that tells blood vessels to relax and widen. When magnesium levels are low, blood vessels stay more constricted. Blood has to push harder to move through them. That raises blood pressure. And here's the concerning part: magnesium deficiency is extremely common. Modern diets high in processed foods, refined grains, and sugar are low in magnesium. On top of that, high sugar intake increases magnesium loss through urine. Even our soil contains less magnesium than it did decades ago due to modern farming practices. Studies show that lower magnesium levels are associated with higher risk of hypertension. Clinical trials also demonstrate that magnesium supplementation in appropriate individuals can lead to meaningful reductions in both systolic and diastolic blood pressure. Magnesium-rich foods include leafy greens, nuts, legumes, seeds, dairy. If you have high blood pressure, discussing magnesium status with your healthcare provider may be worthwhile. Now let's talk about insulin. Insulin isn't just about blood sugar, it directly affects blood pressure. When insulin levels are chronically elevated, the kidneys retain sodium instead of excreting it. More sodium retention means more water retention. More water retention means higher blood pressure. This happens even if your salt intake hasn't changed. That's why people with insulin resistance, prediabetes, or type 2 diabetes often develop hypertension. Lowering insulin levels, often by reducing refined carbohydrates and sugars, can improve blood pressure even before significant weight loss occurs. This is one of the reasons dietary improvements often lower blood pressure more effectively than sodium restriction alone. Now let's add another piece: fructose. Fructose is a simple sugar commonly found in processed foods and sweetened beverages. When consumed in excess, fructose increases uric acid production. High uric acid levels interfere with nitric oxide production, which means blood vessels lose their ability to relax properly. Uric acid also makes it harder for kidneys to excrete sodium efficiently, so you end up with reduced blood vessel relaxation, increased stiffness, increased sodium retention. Cutting down on processed sugars and sweetened beverages can significantly lower uric acid levels, and blood pressure often improves as a result. Potassium, the missing counterbalance. Now let's talk about potassium. Potassium works in two critical areas. First, it helps blood vessels relax. Second, it tells your kidneys to excrete excess sodium. It essentially balances sodium's effects. But modern diets are typically high in sodium, low in potassium. This imbalance alone can contribute to elevated blood pressure. Potassium also reduces activity in the sympathetic nervous system, your fight or flight response, which otherwise increases blood pressure during stress. Good potassium-rich foods include potatoes and sweet potatoes, tomatoes, spinach, beans and legumes, cucumbers, eggplant. Interestingly, many of these foods are also magnesium rich, giving you dual benefit. The bigger picture: high blood pressure usually isn't caused by one single factor. It's often the result of multiple small stresses adding up. Common contributors include poor sleep, insulin resistance, low magnesium, low potassium, excess fructose, and chronic stress. For example, certain endocrine conditions like primary aldosteronism can cause resistant hypertension. Vitamin D deficiency, B12 deficiency, elevated homocysteine, and sleep disorders also contribute. The earlier you address these factors, the more reversible high blood pressure can be. Once arteries become stiff and lose elasticity over time, it becomes harder to fully reverse. Salt matters, but it is rarely the whole story. If your blood pressure remains high despite cutting sodium, it may be time to look deeper at metabolic health, at nutrient status, at insulin levels, at uric acid, at potassium balance. Addressing these root causes can sometimes reduce blood pressure significantly, and in some cases, reduce reliance on medications under medical supervision. If you found this video helpful and educational, please like this video, follow the channel, and share it with someone who needs to hear this. Your support helps spread evidence-based health education. Stay healthy, and I'll see you in the next video.